Okay, thank you for joining us today. Just a quick little bit about how this is going to work. Dr. Farnitano has a quick statement that he'll read, and then we've received a number of questions through our email address, and we will make our way through those. Those of you watching, if you have questions that you'd like to post in chat, we'll keep an eye on those as well, and we will get to as many of them as we can in the half an hour that we have allotted. So Dr. Farnitano, I'll turn it over to you.
Thank you. Good afternoon. So today, Contra Costa issued an updated health officer order along with 5 other Bay Area jurisdictions. The Contra Costa order will go into effect at 6 o'clock in the morning, tomorrow morning, Tuesday, May 19th. This regional approach we have been having to slowing the spread of coronavirus has been working. This collaborative effort is important because the Bay Area is one human ecosystem, and this virus does not respect borders or boundaries. The order does allow for retail establishments, all retail establishments, to offer storefront or curbside pickup. It also allows manufacturing, warehousing, and logistical operations that support retail operations. Those can resume as well. We are counting on these businesses to consistently follow social distancing protocols and our public health guidance so that they can operate safely and protect both their employees and their customers as these activities resume. That's important because COVID-19 continues to pose a very significant threat to our county. The numbers of new cases statewide are not going down, and so even though we've seen some local improvement, the virus is still out there. We realize this is not easy. These stay-at-home measures have been difficult for all of us, but we all must work together to ensure that we do not see another surge, another increase in cases as we increase the amount of activities and businesses in the community. We are making a lot of progress on our key indicators. That includes the COVID-19 hospitalizations in our county are decreasing, and our hospital capacity remains sufficient to manage them. Our hospitals are having more PPE available, although we're still seeing shortages in our PPE supply, and we are still not able to get back to a normal supply chain for both hospitals, nursing homes, and other medical facilities. Our number of testing sites continues to increase. Our test numbers are increasing, but we are still not at the target goal of the number of tests per day we would like to be doing. Our trend of new cases has been stable for the last several weeks, and our ability to conduct case investigations and contact tracing is improving, but that also is not yet where we would like it to be. So we're making progress on our key indicators, and that has allowed this further step-by-step reopening of our economy. We are going to need to continue to ask all our community members to follow our key measures to help stop the spread, which includes hand hygiene, social distancing, wearing face coverings in public, and really trying to ramp up our testing so we can identify cases early. Then I'll turn it over for some of the questions that were submitted.
Great. So the first one is, we continue to receive numerous questions from the public about how, if to socialize as stay-at-home orders relax. Can you provide any guidance for how people begin to see friends and family members?
This is a challenging area because gatherings outside of your household are a big risk for spread of this virus. And the state currently has group gatherings outside the household as part of their phase 3. So we aren't allowed currently to be any looser than the current state guidelines. And so we still don't know yet at what point we'll be able to encourage people to get together with friends or family outside of their households.
Is there a plan in the foreseeable future to increase camp childcare numbers up from 12 kids to 1 teacher ratio?
We are still working with the state on different guidelines. Right now, our recommendation is in the health orders state that stable groups of 12 for childcare and camps, which often provide childcare for youth and children, that they stay in small groups, 12 or less, and the same stable group of adults with that stable group of 12 to minimize the risk that if there is a case, it spreads only in a limited group of people.
When can salons reopen?
That's a hard issue because I know folks are wanting to get their hair cut and the other kind of personal care that salons provide, but personal care is a very high-risk activity. It involves close contact between two people, and so the state currently has that in their phase 3 of activities, so that's not allowed at this time.
There are currently 16 people in the hospital with over 2,000 beds in Contra Costa County. That's about a 0.8% occupancy. Can you please explain why we are running out of PPE when the hospitals are empty?
Yeah, it's a good question. So, you know, we had over 40 patients in the hospital a few weeks ago, and it's down to 15 to 20 per day. But PPE is used not just for caring for those individuals, but it's being used for patients who have respiratory symptoms, who are potentially could have COVID. It's used in testing locations when we're collecting tests on individuals. And across the board, since this pandemic has arrived in the United States, the standards for personal protection have increased, that doctors' offices, medical offices, a lot of different care providers are being more careful based on CDC guidelines to use masks and N95 masks and gowns and gloves in situations where previously they weren't being used consistently. So there's an overall increased need for this type of equipment. We're getting requests from dentist offices and medical offices as they're opening up their routine care, that they're looking to find this, and they're not able to find it from their normal vendors. And there also as this has been a worldwide pandemic that has really affected countries across the globe, there's been a breakdown in the international supply chains for these materials. And so there are a lot of domestic producers are trying to ramp up their supply, but a lot of facilities can't get the masks and the gowns and the gloves from their previous vendors that they used to be able to get them from.
Over the past few days, there have been less and less people tested. Is that because there just aren't people to be tested?
The test numbers do vary from day to day. There's also lags in reporting from certain places. Some may take a couple days to get the result to the patient, and then they may take a few more days to get the results into our system to report to the public health department. Others are faster at reporting that. So some of the variation is on the lag in reporting. Some of it is the variation from day to day. We're seeing overall our average testing is steadily increasing. We were testing about 300 tests a day a few weeks ago, and now we're up to 400, 500, getting close to 600 tests a day countywide. That's still below where we want to be. We want to be at around 2,200 tests per day, and we're really relying on not only the county-run sites and our state testing sites, but also our community partners. There's a lot of community provider offices that are now doing testing. Our large health systems like Kaiser and John Muir and Sutter Health all have testing sites. So we're also relying on them to help meet our testing goals.
My understanding is masks are not mandated outside. Can you please clarify this? There have been a lot of mask shaming, mostly due to misinformed people.
We're really asking folks to be cooperative with the guidelines, not to do mask shaming, but to lead by example and follow the directives. We use the term face coverings because it's not always a medical grade mask, but it could be a bandana, it could be a scarf over your face. And we do require it anytime you're out in public and you're close to other people. So that includes going to retail stores, if you're going to work outside of your home. If you are exercising and you're exercising by yourself, you're walking on a trail, you don't have to wear the face covering then, but we do recommend you carry it with you so that in case you do come into contact with somebody and then you get within 6 feet or so of another person who's not in your household, then you can put on your face covering.
Please provide guidance on how the county will proceed to move deeper into phase 2. The county and cities need this ASAP.
So Governor Newsom, when he's laid out his phases of reopening the economy, he's clearly identified that there are really 3 groups of counties that will be moving at different paces. One group is very rural counties that have very few cases and have a very spread out population density. Some of those, like in the far north part of the state, that will be applying for exceptions to be able to move faster than the state and open up faster. There's other counties that will be moving right along schedule with the state's pace for opening. And then there's a third group that is mostly more urban, denser populated counties that have higher numbers of cases that will be moving a little bit slower than the state. And that includes most of the Bay Area and a lot of the denser population counties in Southern California. And so we've said that we are going to be looking at our indicators and how we're making progress towards them. And then when we make a big change, we're going to really be looking at the effect of that change before making another change. So we made a big change on May 4th, exactly 2 weeks ago today, where we opened up construction and outdoor businesses and a lot of outdoor recreation. And we know it can take 14 days before people can develop symptoms from COVID-19. So we wanted to wait at least those couple of weeks to see whether that change led to a surge of cases. And since we have not seen that surge in the Bay Area and we are continuing to make progress on these indicators, that allowed us to make this change today and open up more businesses. We'll continue to look at those progress towards the indicators, follow the numbers, but we need to take time again after a change to see the effect of that change before we make another big change.
I am curious why Contra Costa County is not reporting on 2 of the key metrics that are being used to determine reopening the economy of the Bay Area. The website has said coming soon for PPE supply and contact tracing for weeks.
We're still working out the best way to measure and collect that data and display it. We do know from talking individually with hospitals and nursing homes that they do not all have a 30-day supply of PPE, so we do know we are not meeting that PPE metric at this time. And we are also scaling up our contact tracing staff, and we know we're not quite where we need to be with that. We are actually fortunate enough to be selected as the second county in the state to pilot a new software for more efficiently doing contact tracing that the state is rolling out, and that will help us better execute our contact tracing as well as measure our progress towards these goals. So we hope to have those metrics up there on our dashboard very soon.
In Contra Costa County, who is in charge of determining whether or not the county will move forward with the rest of the state throughout the different stages of the phase reopening? How is this determined?
So the ultimate authority for issuing the health order does rely on the county health officer. We do take a lot of input from within the health department as well as lots of different sectors of the county. We work closely with our Board of Supervisors and other representatives throughout the county. There's now a weekly ad hoc committee of the board that is seeking input about ways to open up the economy and recover step by step. We're also working very closely with the other counties in the Bay Area. Again, we are one human ecosystem. There's so much work and shopping and travel between different Bay Area counties. So what happens in San Francisco and what happens in Alameda County affects Contra Costa County. So we're really working very closely so that we can coordinate our efforts so that we can be more effective together.
Why don't you release figures separating out cases in SNFs and assisted living facilities?
SNFs are skilled nursing facilities, and assisted living facilities are also facilities that often provide care for the elderly. And these are places that we are very concerned about because they have some of our most at-risk elders. And there's been, outbreaks not only in our county but throughout the U.S. Those are regulated by the state, and the state is requiring reporting for cases at skilled nursing facilities, so those get reported up to the state. We do work cooperatively with those facilities when they do have cases to help assist them with case investigation and testing and making sure they're doing everything they can with their infection control practices to limit any further spread. But the regulation of those facilities and the reporting of those facilities is all done through the state.
Is our county less affected in nursing homes than others, or is data simply missing at the state level?
We have been fortunate that we have only had a handful of outbreaks in our nursing facilities and assisted living facilities. We have, we have about 30 skilled nursing facilities in our county, and we have many more assisted living facilities. There are over 60 large assisted living facilities, as well as numerous very small ones. So we've been fortunate in that most of those facilities have not seen outbreaks, and we have really worked very closely together with those facilities. We've sent teams out to work with them to review their infection control practices. We have worked with them to make sure they have adequate personal protective equipment, masks and gowns. And so we've been working really closely with them. We think that's made a difference in helping prevent outbreaks. We're now working with a lot of these facilities to institute routine testing even before an outbreak of the staff and the residents. Nursing homes are now being required by the state to institute regular testing, and we're also we're also recommending strongly that assisted living facilities also institute some routine testing on at least a monthly basis of their residents and staff. So we're working with them to make sure that they have a plan in place on how they can start doing some regular testing of their staff. Because in addition to all these infection control protocols that they've all been putting in place that have been effective, we think a regular testing schedule for high-risk situations like nursing homes may help catch a case before it turns into an outbreak.
So the American Medical Association recently released some new information around having sex during the time of COVID. Can you give us a little briefing on what their new research says?
Well, some of the research does show that COVID is detected in a lot of different body fluids. We already knew it was detected in respiratory fluids like saliva and when people sneeze. It's also been detected in semen. So we know that that sex can also be a way to, of spreading COVID-19. It's just more that we're adding to our knowledge about the different risks of close physical contact leading to the risk of spreading this virus, and that's why all these different social distancing measures are really so important.
Why are you allowing cleaning services to resume but not hairdressers?
So cleaning services are allowed for commercial facilities. They are not still yet allowed in private homes for the most part. This is part of the latter stage of phase 2 of the state's order, but they haven't yet been allowed in the local orders. And again, we're moving a little bit slower in pace behind the states opening up. So that may be coming soon whenever we get to the point of moving into kind of the second part of phase 2.
The community needs more clarification on children and childcare camps recreation. Many are confused by essential workers, children only benefiting from this. Can you help us understand?
The regulations around childcare are really around allowing workers to be able to go to work who have families. So allowing workers, whether they're essential workers or other allowed businesses, that will include a lot more retail and manufacturing, and including, many people are working from home because their type of work is a kind of work that can allow them to work from home. But they still need childcare as well. So we have childcare guidelines that allow childcare in small groups of 12 children and a stable group of adults that aren't mixing, so that if there is a case, the spread is limited to within that group and not a wider group. We know that camps are also a source of childcare during the summertime, so this childcare guidance also applies to camps. But this is really at this point limited to only the children of working parents, parents who are currently working. And again, the idea is to allow adults to work while providing childcare for them in the form of whether it's a camp or another kind of childcare institution, but it's got to be in a very strict way so that it doesn't lead to the spread. We do know that children tend to get less sick when they get COVID, but there have been serious illnesses in children. But even more importantly, children can bring this virus back home to families, and if there's elderly or people with chronic illnesses in those families, those children can be a source for bringing the virus back into vulnerable adults. And so it's important we try to reduce the risk of spread in children as well as in adults.
Do we have antibody testing available?
So antibody testing is starting to become available at certain medical facilities, but it's really still in its infancy. We still don't know a lot about the antibody test results for it to be very helpful. For the most part, it's really a research tool to try to understand how much the virus is spreading in our community. Some of the tests don't have enough accuracy to be that reliable on an individual basis. We also don't know for sure what the antibodies mean. Does it mean you're immune? Does it mean you can't get the virus again? If you're immune, does it last for a month, a year, a lifetime? We know that some viruses like measles you get once and then you're immune for life. Other viruses like the flu you get and then you can get it again a few months later. So we're still learning so much more about this virus and what the antibodies mean. And so we're not really recommending it for individual use because first of all, if you get a result and it says positive or negative, we still don't know if that test is accurate enough to be a result you can believe in. And then secondarily, we don't know what to do with that information.
Maybe you can talk a little bit about how we're working closly with East Bay Regional Parks regarding the rules around trails and parking lots. How are they making decisions and how are we helping to guide those decisions?
We are working very closely with all our parks partners, including East Bay Regional Parks. We're trying to apply those principles of social distancing that are key to reducing the spread of this virus. We're really empowering the parks departments to really adjust their policies based on the reality on the ground that they're seeing. Are they seeing a lot of crowding in parking lots? Are they seeing a lot of crowding in trails? Are people staying apart or are they coming close together? And so the parks are really adjusting their operations accordingly. So initially a lot of parks, they closed the parking lots. I've seen a lot of parks now starting to open up the parking lots because they're seeing more cooperation, that people are doing the social distancing. And so the more we get the public to really follow these facial covering rules and the social distancing rules, the more we'll be able to keep our parks open. A lot of the counties along the coast had to close their beaches because there was just too much crowding going on at the beaches. It was really creating a public health risk. The more we can really have everyone follow these rules, the more we can keep these activities and keep these beautiful parks open for all of us to enjoy.
What about dog walking businesses? Are they allowed?
So dog walking is allowed under certain conditions. The concern is of mixing dogs between multiple households. There's now research that shows that animals can transmit COVID-19 between animals and between humans and people. So there's concern about a dog walking multiple dogs from multiple homes at the same time, that could be a venue for spreading COVID-19. But dog walkers who are just walking animals from one household at a time, that wouldn't have that same risk, and that would be an allowable activity.
So doctor, we get a lot of questions about this, so I'm going to take you back 1 minute to childcare and camps. So someone posted, so to clarify, if even one parent is working, dropping the essential criteria, whether from home or at an actual facility, our children are eligible for childcare camps recreation moving forward in accordance with the county guidelines. Is that correct?
Yes, that is correct.
Great. And I'm going to take you back to one more question because we're getting it a lot. If you could talk one more time about hair salons and barbers.
Yeah, and it's a hard thing. My wife cut my bangs yesterday, and I think she did a pretty good job. But it's been a real struggle for folks because you know, we all want to get our hair cut, but it's such a high risk activity. You know, you're in very close contact with a stranger outside of your household, and there's so much risk for transmission of this virus. There's also, we still have a shortage of masks, these medical grade masks, especially these N95 masks, which are the highest level of protection. And so, you know, we don't want to be having salons be using those when we can't get enough for our nursing home staff and other medical sites as well. So until our PPE supply is better, the state's working on guidelines for safe operations of these salons once we move into phase 3, where the state currently has these. But these type of operations, because they're higher risk, that's why the state has them in phase 3, and they'll have to wait until the state moves into phase 3.
Great. We have about 1 minute left, and that really is the majority of the questions that we have gotten, so we've made our way through those. Do you want to just say something in closing to folks as we finish up?
Yes, it really is a new world we're moving into as we're slowly opening up our economy. It's not going to get back to life as it was before this pandemic started. There are going to be some things that may be long-term changes for us, and it's these key principles that we're going to need to follow, that everyone in our community is going to need to follow in order to keep this virus rare and keep further outbreaks and further surges away. So that's the social distancing. That is the covering your face when you're out in public. That is hand hygiene, so washing your hands frequently, using hand sanitizer. And that is, don't leave your home if you're sick. So if you have, even the slightest, fever, cough, cold symptoms, cough, don't go to work, don't go to the store. So those 4 key principles are things that we're really going to need to adopt as a society for the long term to allow us to get more back to a semblance of a normal life and a normal economy. Thank you.